kick off our meeting with our thought of the day, which today is brought to us by Dennis Hunter. Dennis, are you ready? Oh, wait, hold on. Dennis is muted. Can you unmute yourself? I can't seem to unmute you.
There you are.
There we go.
Okay. As I said, can you hear me now?
Perfect.
Okay. Well, I was kind of thinking, I saw a cartoon in the paper the other day where it showed a family sitting around the table and they had their noses in their cell phones and so forth. Nobody was paying any attention. That was before the virus struck. Then afterwards, you see everybody out for a walk. That's after the virus struck. So that kind of showed me included, that sometimes you take things for granted, like we're only about 5 or 10 minutes away from the beautiful Pacific Ocean. Or if you go over to Sequoia Park, you can see the redwoods. You don't have to go very far. But I found this online and I wanted to read it to you. In fact, Karen found it, gave it to me. When this is over, may we never again take for granted a handshake with a stranger, full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, the taste of communion, a routine checkup, a school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be, we were called upon to be, we hope to be, and may we stay that way, better for each other because of the worst.
Very nice. Thank you, Dennis. Wonderful. Silent virtual claps. All right, and before I get fully into the program, I did want to introduce some guests that we have on with us today. Roberta Leskin-Hawk, CEO of St. Joseph Health, is on. She will be our program a little later. They have certainly been busy, so I'm excited to hear what Roberta has to tell us. We also have Ken Singleton, who is president of Southwest Eureka Rotary. He's joined us today, as well as Al Spear, who is the president of Old Town Rotary. Thanks for joining us today, guys. And then let's see, I saw Amanda Nelson is also here. She is a Rotarian with Old Town Eureka Rotary. And did I miss any other guests? I don't think so. Christian.
Carly, it's Christian Hill, a former Eureka Rotarian and serving as a complement to Roberta, although, and albeit she is the main part of the show here. I just want to come and say hi to everybody, my old Rotarian friends, and to add, if needed, anything that Roberta is going to talk about today.
Wonderful. It's good to hear from you virtually, Christian. All right. Okay. I am going to see if I can share my screen real quick.
I'll take mine down. How's that? There we go.
Okay. All right. And let's see. Oh, doesn't want to let me for some reason. Okay. Well, while I'm trying to figure this out, Nancy Dean let me know that she recently talked to Michelle Nielsen with an update on Carlton. Carlton is out of ICU, which is great. And I think Nancy said that they are talking about discharging him. He would still have to stay in the Bay Area, but that all speaks very well of him recovering from his liver transplant surgery. So that is highly encouraging. All right. Well, I can't seem to share my screen. That's okay. I'll just go through with verbal updates. As many of you know, we've been pushing to do a blood drive in honor of Carlton since he has had to use several blood transfusions through his recent medical struggles. So we had a quick program last week from John over at the blood bank. Thank you. Well, Kate is on, but I don't see her at her desk. So thanks, Kate, for allowing John to join us. And I wanted to give Jara Newland a shout out because she posted that she went and donated last week with a very nice photo. Also, coming up, let's see. Oh man, why can't I share my screen? Oh wait, there it is. All right, I figured it out, guys. sharing my screen. Can you all see that? All right.
Yes.
Perfect. All right. So Sandy, our exchange student who is still here from Paraguay, was able to still celebrate Easter with her host family. They did a full dyeing of Easter egg and Easter egg hunt. I don't know what Sandy's current travel plans home are yet, but I'm very happy that her current host parents, Ian and Elizabeth, have been keeping her busy during quarantine, which is tough for any high school senior, but also one who is abroad is very tough. So if you see either of them, give them a big thank you for all they are doing for Sandy. There's Jara giving blood. This happened last week for anyone who's curious what I've been up to. Food for People held a big emergency drive-through food distribution. The idea being that many more people in our community are suddenly experiencing hardship than before. Many of them have never needed to access assistance resources, and many of the resources that they're applying for now will take several weeks to come in. So we set up an emergency food distribution Friday. We did it at the Bayshore Mall parking lot. And in just 2 short hours, we served over 540 boxes out that represent about 1,300 individuals in the community. So that was awesome. And a lot of hard work gone in by many people. We had partnership from Eureka Police Department, CHP, Cooperation Humboldt, and Rise Up Eureka. So a lot of people came together to make that happen. And Ken, do you want to talk a little bit about what Southwest Eureka has going on or in the works?
Can you hear me now?
Yeah.
Yes, okay. My name is Ken Singleton. I'm the president of Rotary Club of Southwest Eureka. Ron Harris, our former member and our current honorary member, has pledged $5,000 for us to raise dollar for dollar. And as you remember, he did that, the same thing for the Santa Rosa fire, gave $10,000 to our foundation. And all of us, Eureka Club, Old Town, and Southwest, was able to raise over $30,000. And this time he has pledged $5,000. And for us to do whatever we want to do with that money, as long as it's related to the coronavirus. And as you know, Carly is involved with the food bank. And because of her letter that stated the heavy need for the Food for People, we have decided that we'll raise the money towards food bank or Food for People. And to this date, we have raised over $5,000 from our club. And with Ron's money, that has gone up to $10,000, the same, and make the check out to Rotary Club of Southwest Eureka Foundation and endorse a check to Food for People Food Bank. And that way, we can really help our community because there's a tremendous need for food for the people. And that is what we need to do for our community. So I'm asking your help in joining us to raise as much money as we can for the food bank. Thank you.
That is wonderful, Ken, and it's very much appreciated. We have a board meeting coming up for the Rotary Club of Eureka board, and I want to talk about what we can do from our own club, but I'm also hoping club members would be interested in joining in and giving. So I will be sending out some more information after today's meeting, but I would love if our club could also help contribute. A lot of people in our community are hurting right now. Pantries throughout the county are reporting increased need that they haven't seen in years. So the extra help is very much appreciated right now. So thank you, Ken, and thank you for joining us today.
Thank you, Carly.
All right. Next. Oh, my Rotary Minute for today. So instead of showing a video today, I just wanted to go over the Rotary 4-way test. So for any longstanding Rotarians, you might know it by heart. For any new Rotarians, you may not know all about it. The Rotary 4-way test was adopted in 1943 as a way for Rotarians to judge and decide what it is that they're going to do. So the 4-way test, let's see. I'm going to stop share real quick so we can see everyone. Does anyone want to give me the first of the 4-way test? And then I know we got Rotary to know it.
Is
All
it
right,
the truth?
Clark. Oh wait, someone said it. Is it
Is it the truth?
Yeah, I said, is it the truth?
perfect? All right, what about the second one?
Is it fair to all
Fair
concerned?
to all those, yeah, are you reading it? I'm reading it too.
Oh, Brad's got his coin.
Peters.
All right, Brad, you want to finish this out since you have your coin handy?
Sure, if I get the light on it right. Will it build goodwill and better friendships? And will it be beneficial to all concerned?
And
There we
Bruce
go.
has his plaque. Perfect. All right. Well,
Yes.
very good tools to use when making any decision, not just Rotarians, but for us in our daily life. All right. Back to sharing my screen. Excuse me. I have a bit of a cough. All right. So a little recognition before we get into our program. Birthdays we have coming up: Jenny Finch, Ken Stoddard, Jack, Blaine, and Lydia. And then member wedding anniversaries. Blaine already celebrated his, but Anthony's is coming up soon, and hopefully he will be out of tax season and have a little breathing room to celebrate. Tom Schallert, I think, is on the call today. I saw him join. And he shared this neat thing: Wall Street Journal's 10 questions. Look who got quoted in the most recent one that went out, our own Tom Schallert, giving an update on what all they have been doing in quarantine. So, well done, Tom. I wanted to give a personal shout out to Steve and his entire team at Stewart Telecommunications. Many of you know Food for People had to move out of our main site following the damage to our building, and we're now spread out across 3 separate sites. And as you might imagine, transferring a phone system and internet system across 3 different sites and keeping it all together is very difficult. And Steve and his team have been just amazing, jumping through all the hoops to make it happen for us, being really flexible. And I can't say enough good things about all of the help that they've given us through this process. So we all know that Steve does a good job, but I just wanted to give him a shout out for that. All right. Also, one of our member businesses that's been getting a lot of recognition lately, Redwood Capital Bank, has been doing the federal PPP loans and has been getting some good love on Facebook for the work that they're doing, including Cafe Nooner 2. So these are loans that are forgivable for small or for businesses who maintain employee salary and wages throughout the coronavirus pandemic. And as long as they continue that, the idea is those loans will be forgivable. So that is keeping a lot of our small businesses going in a very difficult time. So Redwood Capital Bank and all our financial institutions making that happen is very much appreciated for our community. I don't think I've seen Jennifer on the call today because she's been very busy, but if you see her, tell her job well done. I know she's been working on that pretty hard. All right. Jera, I mentioned, gave blood, but she also has had some fun new additions to her family. They have adopted some little chickens while in quarantine. If you see Jera soon, ask her how it's going. All right, this was a nice thing Linda shared happening over at Recology, Humboldt County. All of them are still working hard to, pick up all of our trash and recycling through all of this. I know they're still doing all the sorting, so very tough job and one that is continuing through this crisis. So job well done for all of the Recology employees. All right, that is it for my program today. So I want to stop sharing my screen and I am going to hand it over to Roberta so she can share her screen and tell us what has been happening at St. Joseph. All right, I'm seeing her screen. Let me make sure. Roberta, are you muted?
Roberta, are you on mute?
You're muted.
Let me see. Wait, I just saw.
There we go.
Perfect.
I knew it was there somewhere. It just was hiding. All good. So thanks for having me today and trying to make this work virtually. We often will start just with a reflection, and some of you may have seen reference to this, but it's certainly striking to us that a little over 100 years ago, the Sisters of St. Joseph, who actually came to Eureka to do education, switched over and decided they had to learn about healthcare in response to the 1918 flu epidemic. And I think the kind of the resilience they demonstrated is something that we like to remember as we face this in our centennial year. The hospital was actually founded exactly about 100 years ago. Many of you have not met my team. Some of the members are new, and some of the work that I'll talk about is really because I have a fabulous team of people around me. Dan Kelly is our Chief Nursing Officer. Jim Tanner is our Interim Chief Medical Officer. Lori Watson-Stone is probably known to most of you as the Chief of Support Services. Paul McGinty, my Head of Philanthropy. Lisa Jacoby is our new Chief Mission Integration Officer, who's actually here. Wendy Lauder is over the Care Experience, and Dave McClung. So that's my team, and many others who've been working tirelessly about 18 hours a day recently. The data from this disease in the world is ever changing and somewhat daunting, but I usually in any discussion like to start with where's the world in this, and then quickly come down to Humboldt County. So as of today, there were about 1.8, almost 1.9 million confirmed cases of COVID-19 around the world, and probably many, many more where testing has not been done, some of them very mild or even asymptomatic. And the US is now up to 558,000 with surge happening right now in many areas. When you look at the US, this is from the Johns Hopkins website that has tracked this. This is probably no surprise, but we see on the West Coast, Washington State, pretty heavily impacted, Oregon somewhat, and you see a lot of California, obviously East Coast, Midwest, Florida, Louisiana, all very heavily impacted. And then you get a sense more of rural America where we're seeing less, but we're certainly seeing it. And I know the New York Times in the last couple of days had an article that mentioned that Humboldt County actually had the first reported case in a rural county across the country. And I think part of that was the vigilance we had, and it probably a call on a Sunday night from me to public health didn't hurt either, to make sure that the people got tested. This looks at our experience in Humboldt County. And in February, we had one confirmed case and one indeterminate, clearly travel related, and very, very well contained. They sheltered at home. They were very cognizant of what they needed to be careful. No issues related to that. And then starting around March 20th, we started seeing more cases. And these are the number of cases tested positive on any day in Humboldt. And what we so far, the total testing is 803 by public health. Public health has done a fabulous job at ramping up and developing capabilities, as well as some outside tests. And then we have, for 4 days running, there were no new positives, which is a very big deal. Looking at this curve, again, you had just the one case. These are the cumulative cases. There's no question that sheltering in place is having a major impact, and that having done it early is having an impact. What we know about the cases so far is that 20 were travelers. They had traveled mostly internationally, and then when they came back, there were 23 people who were exposed to the known cases. So that was the primary way it was spread. But then more recently, we've seen 7 who appeared to acquire this virus just in the community without any direct connection with someone who either traveled or with a known case. And so the fact that we're seeing some in the community is the worry. The public health has been very good about identifying people and doing, at this point, contact tracing to try to quarantine people who might have been exposed. We're in a very different place than many big areas. Many urban areas are at what they call the mitigation phase. It's just out everywhere. They're not going to be able to contain it, but they're responding where they can. We're really still in the containment phase where every case is important, and it's why more testing will only help us. So for people in the community, I want to just make sure that you are aware of some of the resources we have available. I think that there's so much information coming at people that it's often pretty overwhelming. But what we know is that 80% of the people who get this disease are well enough where they don't have to be hospitalized. And it's actually in the interest of the public health for people to stay home when they're not too sick. But how do you get enough information to feel that you're staying home safely? On our website, which is www.stjohumboldt.org, you'll see that in addition to our usual content, there's this red bar that has COVID-19 advisory. And if you click on that, you'll find some resources. And this is for anyone who's a member of a public. You don't have to be in any way affiliated with a St. Joe's doctor or anything else to be able to use these tools. If you go in, you'll see information that reinforces the importance of staying home and staying safe. And then if you go down, you'll see a couple of tools that are unique. One is called the Coronavirus Assessment Tool. If you click on this, you start seeing this little bot that talks about, that uses artificial intelligence or AI to give people information, and it will ask you questions about your age, whether you've tested positive for COVID, whether you have fever, shortness of breath. And it doesn't replace a full medical evaluation, but it gives you some general guidance in terms of whether you should seek advice of a physician, go to the ER, and it provides some good information. This was developed by Providence. So our parent company is Providence St. Joseph Health, which has 51 hospitals across the system. And there are a number in Washington State and Oregon where they had, unfortunately, quite a bit of early experience with this virus. And they partnered with Microsoft to kind of refine this tool. So this is available, again, to anybody. We shared it with Public Health, who's also shared it with the public. Now, many physicians in town are also offering virtual visits. If you already have a doctor with St. Joseph Medical Group or with Open Door, you can get a virtual visit through that mechanism. In addition, we know that many people in Humboldt have had trouble getting a primary care provider. And this Get Care Virtually button connects you with about 7,000 physicians in a much wider geography. So many of them are outside of California even, who can do a virtual visit. Now this one, there is a charge of $49. So that could be an issue for some people, but it is something that's available 7 days a week. If people feel like that physician about whatever symptoms they're having. In addition, as you click through, you'll find other guidance. There's information on the change in our hospital visitation policy. Hospitals across the country have been severely restricting visitors, knowing that people can be shedding virus for up to 5 days before they have symptoms. We've tried to really limit the number of people coming into the hospital with a patient. We understand that that's challenging for our patients who may be sick. There are some circumstances like end of life or a woman in labor where there is an exception made, kind of case by case. But for some people, we're encouraging a lot of use of cell phones, and for people who don't have a device, we have some iPads specifically for some of our patients who are in isolation and need an opportunity to connect with a loved one. So that's going on. Now, testing and evaluation is available a number of places. For people who are patients of St. Joseph Medical Group or who work for the hospitals, Dr. Skye Heston has a drive-through evaluation process at 2280 Harrison. For people who are a part of Open Door, they have 2 locations where testing is available and evaluation, both one in Arcata and one in Eureka. And then the Redwood Memorial ER and the St. Joe's ER have tent set up for evaluation. Now, many times, people who are evaluated are not getting the test done. The test is in limited supply and is still being prioritized for hospitalized patients or healthcare workers with some symptoms. What we need to know is it's safe for them to work. But increasingly, tests will be more available. And most importantly, in this evaluation, the decision is made, are you safe to go home or do you need to come in the hospital? We now have a new tool that we just started on Friday that we're using for patients who are well enough to go home, but a subset of patients who might be at more risk of getting sick because of their age or because of underlying diabetes or heart or lung disease. And so through telemedicine, we have the ability to have a pulse oximeter, it's called, so a little thing you put on your finger, which gives your oxygen. We give a thermometer, and patients actually will get a call. This is from our telemedicine folks up in Providence. It's Providence Home Monitoring. And there's no charge for this, and it's not a formal telemedicine visit. It's just monitoring, checking in to see how someone's oxygen is, how they're breathing that day, and then if they need a clinician or an ER visit, that can be expedited. So the challenge of this pandemic has certainly pushed us to move faster with some of these telemedicine and virtual visit capabilities, some of which will probably last after this is calmed down. So in our planning, there's a lot of talk across the country that with a surge in patients related to COVID-19, that the volume that hospitals will see could really outstrip usual capacity. So we've been planning, and in any planning for this type of a epidemic, you're looking at people, places, and products. So working with physicians and nurses and advanced practice professionals, physician assistant and advanced practice nurses through the community to repurpose some people and say, well, you used to work in a clinic, but that clinic's quiet right now. We want to bring you in to be part of teams for the hospital where we may be extremely busy. In addition, we've got we've added some telemedicine capabilities, both for one of our ER docs yesterday said that he was in the ER at St. Joe's and was able to telemedicine into the ER at Redwood to look at moving a patient and actually seeing the patient, talking to the provider. But conceivably, physicians from outside of Humboldt could also interact with us via telemedicine. In terms of places, we've done a lot of work in the last 4 to 6 weeks where we've added a lot of negative pressure isolation rooms. We added a respiratory care unit, created a respiratory care unit at St. Joe's with 32 beds, all negative airflow. We expanded our ICU capabilities from about 12 beds now to up to 35 beds at St. Joe's, and we've added medical beds both at St. Joe's and Redwood. In addition, at Redwood, we've added negative isolation rooms, negative pressure isolation rooms in various places, so ER, medicine, one in OB. In terms of products, we're actively sourcing personal protective equipment, have an order in for additional ventilators, in part based on extraordinary outpouring of generous donors who wanted to make sure that we had a cushion in Humboldt County should we see a major surge in the number of people who need ventilators. The delivery time, we're still waiting to get something confirmed on that, but working on that. Throughout this, there's been incredible community-wide collaboration. I was on the phone this morning with Public Health and Mad River talking about potential alternative care sites, but I think between our hospitals, St. Joe's and Redwood, the St. Joseph Medical Group, Open Door, Mad River, Gerald Phelps, North Coast EMS with City Ambulance in Calor, the skilled nursing facilities, and I think the next step is to coordinate better with the Native American communities. It's essential that we all work together, and there's a lot of communication happening. When we look at treatments, the treatment today is supportive. In the news was some of the information that we were doing a clinical trial on an investigational antiviral drug. We're also looking at other clinical trial opportunities, as well as watching as research is being done very quickly across the country. There are various ways of looking at this disease. Vaccine will be critical. but could take as much as 12 to 18 months to get it generally available. People are looking at immunotherapies if someone's recovered from COVID, their plasma might be protective, antivirals, things that change the immune system. Studies are being done to understand the role of hydroxychloroquine and other agents. So there's a lot going on, and some of it will be part of, others will look to see the results of. Now, what's curious is that, for a period of time with shelter in place, we've suspended many healthcare services, imaging, surgical, medical, that weren't urgent as we encourage shelter in place. In our conversations with public health as recently as today, the reality is that we have a quiet period right now, relatively quiet, and now our personnel we have enough masks that everyone can be wearing masks, and we need to look at opening up services, because if we get very busy with this, it might not be until June or July. And then if we wait on everything, we're talking about waiting till the fall. So some things like a bone density scan, it can wait till September, October. It just shouldn't be done right now. But for our imaging services, we're relying on our physicians to work with the patients, use their judgment about what should be done. When people come, the waiting rooms are more spread apart. They can wait in their cars. We've got pagers. People are wearing masks, so we're doing it in a different way. We're looking at urgent and emergency surgeries are still being done, as well as medical services. One of the cautions is that in many states, especially where there's a lot of COVID, they're not seeing people coming to the emergency room with heart attacks and stroke the way they normally would. And there's a concern that people may actually not be seeking medical care in urgent and emergent situations where care could really help them in terms of their outcome. So it is important for the public to realize that that is still important and that care can be delivered safely. And that is kind of what I wanted to share. Of the 50 people who tested positive in Humboldt County, only 3 have required hospitalization. And when you look at data from even Iceland and other places where they've done a lot of testing, there are a lot of people who may be entirely asymptomatic with this virus, and yet other people get tragically and rapidly. So we're still learning about how often those various things happen, and additional testing, especially some blood testing, will actually help us understand that better. I can answer some questions.
All right, do we have any questions for Roberta?
Hey, Carly, it's Christian. I just want to jump in real quick and just make mention, and Roberta, as is typical of her personality, is very unassuming rather. She's a physician, and she is an infectious disease specialist by trade, and she worked with Dr. Anthony Fauci. We all recognize that name when she was working as a clinician during the AIDS epidemic in Chicago some years ago. So there really isn't anybody that is positioned better to be able to lead our efforts to prepare for coronavirus than Dr. Roberta Luskin-Hawk. So I just want to make sure that everybody knows that, because her work leading what we're doing here at St. Joseph and Redwood Memorial has really put our hospitals in a great position to handle the cases we now currently have and any surge that is expected to come.
Thanks, Christian.
Thank you, Christian. And I also do want to say a big thank you. Probably a month ago, when we were all still new to this and grappling with what to do and how serious it really was, and if we needed to cancel Rotary meetings or not, I got a call from Paul who's a part of Roberta's team, who gave us guidance that yes, you should, at least for the next 30 days, postpone all Rotary meetings. And it was a very nice call to get, to have a healthcare professional step in and give some clear guidance. So thank you, Roberta and Paul and everyone, for making that a clear and easy decision for us. Amanda Nelson has her hand up. Amanda, do you have a question?
Yeah, I was just curious. I know there's been a lot of talk about, antibodies from people who've already had the coronavirus and things like that. Is there any kind of time frame or possibility to test people? Our flu season was really bad this year leading up to the coronavirus outbreak. Is there a way to look back and say, you know, this person had it 3 months ago and is recovered, and what does that look like?
Yeah, that's a very important question. And under normal circumstances, that type of prevalence testing would already be done. It's really critical. So there's two types of tests. The test we do looking for people who are sick is a test looking for the RNA of the virus itself in the nose and in the throat. And that's helpful in the moment when you're sick. The tests that you're referring to are blood tests that look at antibodies. Once you've had the disease, a week into it and later, your blood should show antibodies that you've been exposed and have recovered. And that is very important to know. There's not, right now, there's no FDA approved antibody tests, but they're coming. And once they come, the question is how quickly can we get access to them? But I don't know if you followed in Iceland, just over the last few days, they had some reports that they measured 10% of their population, and about 50% of the people actually had evidence that they'd had coronavirus, and they were either asymptomatic or mildly symptomatic. So it is very possible that there are people who are already immune and don't know it. So it's a very important question. We're just don't have the tools to do it yet. As soon as we do, we definitely need to move forward.
Great. And Bruce Rupp had a question, and then Clark.
Yeah, since I have connections or interconnections with small businesses that operate here in Humboldt County because they're tenants and so forth, I know that a lot of our small businesses right now are hurting very much. And I also know that there's a lot being done to try and help them out, but there's some of these programs are problematic, and they have complications that make them hard to use and so forth. So the question I have, which is I'm not advocating for anything inappropriate, but do you have any estimate as to when it would be reasonable, or if it would be appropriate to ease up on this shelter in place, particularly as it affects the small businesses, without, you know, the resurgence of this virus and so forth? Or are you thinking in terms of we might as well plan to not open small businesses until next year? Or what's your thinking about that without going too far out on a limb?
Yeah, and Bruce, it's such an important question. I think that we'll know a lot more within a month, but I'm not thinking that small businesses will be closed for a year. The things that will help us look at this are getting the blood tests that Amanda asked about. So let's understand who's been exposed, getting about 2 to 3 more weeks of data about local community transmission, so that we know, so we actually know where we're at and can make some predictions. You know, are we in a lull right now where we could ease up even if we have to tighten up again, you know, in June or July or August? And then, and some rapid testing. So I've been working with public health in some way. There's one, the platform that does rapid testing that again helps us contain cases. So it's not really an answer other than to say, I don't think life will be entirely normal until we have a vaccine, but I think that it will, by necessity, get much more normalized. And where we're so minimally impacted right now, we want to keep it that way, but we also understand the stress it's putting. So public health will guide us, but I think everyone's talking about it.
All right, thank you. And Clark, you had a question. Clark, you are still muted. Oh, there we go.
There we go. Thank you so much for being with us today. I can imagine that you're quite busy.
Yes.
So I had a question. I know as Rotarians and just the community that we live in, everybody is really anxious to do something to be helpful. My mom has been making homemade cloth masks. I'm wearing one around my neck until I go outside. I know that she's made some that have ports for respirators. I'm just wondering if that is something that the hospital needs, or if that's something that is being managed by PPE, or kind of what we can do to help prep our healthcare workers and the healthcare system to be ready for whatever surge might come in our community.
Yeah, these are great questions. So Right now, our thought about cloth masks is we do need them, but the way we're using them is not for our healthcare workers. But if patients come in for outpatient tests and they don't have a mask, we want them to happen. Our cancer patients still need to come in for their chemo and radiation. Some of them have masks. We want to make sure they have them. And so there are, and I think at the community at large, we really do want to make sure that everyone who goes to the store and to Walgreens or wherever they are, where there are other people around, are wearing masks. So the cloth masks, I think, provide an important protection in that. When we are talking about our healthcare workers dealing with patients, the isolation masks we can give them provide a higher level of filtration. And so we're traditional hospital protective equipment for our healthcare workers, but believe there's value. The value of a cloth mask is in part, if everyone's wearing them, it's not even so much probably that they're the best filter if someone else coughs on you. If everyone's wearing them, then someone who's coughing or is asymptomatically shedding will shed into that mask as opposed to shedding in others. So it's a little bit different role, but very important in that regard. And in terms of the healthcare workers, I think that healthcare workers have been feeling very supportive. This is a very challenging time, knowing that across the world, healthcare workers have gotten COVID, some have died. It's incredibly important that they be able to focus on doing their job and using their personal protective equipment correctly. We have observers who are helping there. So I think whatever, I guess my thoughts would be, some people have delivered food, which is always welcome, but also if you know them in your personal life, check in on what they need at home, because there's very little respite. Yeah, that would be important.
Thank you.
All right. Do we have any more questions?
This is Brad. I just have a quick question. In terms of rumor control, and from your perspective, is the federal government doing a great job, doing a horrible job, or somewhere in between?
Ooh, loaded question.
Careful, Roberta.
Be politically correct. I understand.
So let me tell you that I will tell you that I worked with Anthony Fauci. I mean, I was not his peer. He was our boss in terms of AIDS clinical trials. He to me is a steady source of truth. He is smart, passionate, cares, analytical, and at 79 doesn't have a lot to lose, I guess. So a trusted resource. These are challenging times for challenging situations. That's who I'd look at.
All right. Very good answer to a tough question. Thank you, Roberta.
Exactly. Nothing like putting me on the spot, Brad. We'll talk that way.
Okay.
Carly, can you hear me?
Yes, Tom.
A couple of questions. The first one, how bad were the cases? That's one. And then following with, is there a mental health crisis line? I was on a call yesterday with a group of people. Several of them were single and all by themselves and sheltering in place and starting to worry about their own mental health. And so I said I wasn't sure, what they should do, but that was a possibility. And then with the treatments, back to the ventilators, if you haven't been using them, what's been the prognosis of those particular patients as far as their the lung capacity and all of those kinds of things. I mean, I have, as you know, Roberta, I used to be the CEO at the blood bank, and so I have just enough knowledge of some of these things to ask questions.
Yeah, Tom.
I always had smart people like you who would always answer them for me.
Well, it's because the number of hospitalizations have been so low, we're very cautious about providing too much information that could be identifying. But
Okay.
say we've
That's
been
fair.
that we haven't had to use a ventilator, that one patient is recovered enough that they're doing quite well. One patient ended up on the investigational trial, and so it's just, that's about as much as I can share with you.
Yeah, that's fair. That's fair.
Roberta,
And what about
I
the
wonder,
mental health?
Oh,
The
sorry.
mental health part of it?
So the mental health question is a huge one. We've done a lot to provide mental health resources for our caregivers, but I don't know of a hotline. I don't know if Christian knows of anything. And I would say the longer the shelter in place goes on, the more critical that may be. And it may be worth talking for me to talk to county mental health and others.
I think so. If I can add to it, you know, it was kind of disturbing. It was a family call, and it was kind of disturbing to hear single siblings of our family that were worried about their mental health and how do I deal with the fact that I'm in these four walls, I can't go out, I can't really talk to people. And we did all the, you know, we were Zooming and doing all that conversation, but they were, you know, they were worried about their own health, and I didn't have a direction to give them yet.
Mm. So as an aside, I have a daughter who's a mental health worker, and she has 4 children. I saw her at Easter, and she's worried about her mental health. I can tell you that.
That's, yeah, understood. So, okay, well, if you end up doing something, I assume you'll put it on your website as well.
We will. Christian, do you have any insight on that? I don't.
Yeah, I was just going to add, Roberta, I would lean on, from a public health standpoint and mental health opportunities and services, it would probably be a good start to begin with them and try to seek out some public health, mental health opportunities there with Dr. Frankovich and her crew there. But just to get back to what Roberta was saying about our healthcare workers within Providence St. Joseph Health, you know, out of our 51 hospitals and 120,000 caregivers, we have healthcare or mental health available throughout the entire system. So those folks who desperately need it, who are reporting on the front lines every day and working, we have through our employee assistance program, free mental health via telehealth, like so over the internet and virtually, that we're providing across the system. So I know, you know, in communities like ours, where the preponderance of you know, this community works at this hospital and other medical providers affiliated with St. Joseph Health, there is a mental health capability and component there. But from the public standpoint, I would advise probably turning to the Humboldt County Public Health Department and see what services are available there.
Okay. That'll be an email.
Yeah.
Great. All right. Do we have any more questions? This has been a wonderful program.
Harley?
Right. Let's give Roberta and Christian a big, oh wait, Dennis, did you have something to say?
Yeah, I was just wondering, you're in kind of echoing what Tom was saying there, the general public in Humboldt County, hearing that for the last 4 or 5 days, no new cases. You know, we all have certain levels of patience. Some have more than others. They see that 3 people are hospitalized and they think, well, gee, that's not very much. Nothing's happening now. Maybe I can go out on the streets again. What do you tell those people? How?
Well, it really is public health that will give the guidance, and with input of a lot of people. I think that what we don't know is how many people are vulnerable. And if we have, if we're in a situation where most people in Humboldt haven't been exposed and people start going out and sharing this, if it gets into one nursing home, if it gets into, you know, one community where there's crowding and poverty, it could spread like wildfire. And so that's, you know, that's the challenge. I think that we, in the next 2 weeks, will have a much better handle. So I'm curious too, that, you know, where we're at right now, I think we're going to have to be somewhat careful for a long time. But over the next 2 weeks, I think we'll get clearer guidance about what that looks like, and we'll be monitoring closely. And as soon as we get more testing, then we can liberalize activity more safely, because we can more quickly identify who's immune, who's not, who's got it, and do some containment. So, but I know that Dr. Frankovich and Dr. Ennis and we talk multiple times a day, but that's going to be a big topic. Not only how do you open up hospital services, but what activities are safe. So I think more to come.
Yeah, I think the sheriff, by the way, if I may, has done an excellent job in communicating the urgency and communicating to the public the necessity for sheltering in place.
Yeah, the risk, I mean, sheltering in place, while it was painful for a lot of people, has done a fabulous job so far. In Humboldt, for sure, it's certainly flattened the curve in California, and yet still many people are dying. You know, and while I see the numbers in Humboldt, we still have people traveling. We still have the community transmission where we don't know where they got it, which means we don't know who else is spreading it today. One has to assume that it is being spread today. It's a question of how many cases, how many are serious. I don't think we've got this completely controlled. And, you know, I just had a friend die yesterday in Chicago with it. So it's still very real. And I don't want us to get complacent, but we'll be thoughtful. I think public health will be thoughtful about their recommendations. If you go out with a mask and socially distance.
All right. Okay, well, we're coming to the end of our hour, so I want to give a big virtual applause to Roberta and Christian. Thank them for joining us. They are very busy. Thank you so much.
Thanks, and thanks for the good work you guys do. Take care.
Thanks, Carly. Thanks, everybody.
Wonderful. All right. So we don't have enough time, like we did last week, to go around and do a check-in with everyone. But if anyone has anything they want to say, I want to give a little time. Chris Marquez did remind me in the chat that tax season is not April 15th this year. It's actually July 15th. So don't take me for it. I completely forgot about that. Thank you, Chris.
I've got one for you, Carly.
Go ahead, Tom.
If you're deciding to what to do with your young grandchildren, like 4-year-old girls, when you're FaceTiming them, try charades. She was a caterpillar, and it took Tessa and I quite a while to figure out what she was. And it's really amusing. So you might suggest that with your young grandkids if you've got them, or even young kids. It was pretty fun event.
Yahtzee's another one. Yahtzee is another fun game, virtual.
One thing we've been doing with our grandkids is we've been playing trivia and letting them come up with their questions, and it's been wild.
Very nice. All right. Is there anyone who hasn't been able to join us before who wants to give an update? I see Kate was able to join us today, and Greg Williston. Anyone want to give an update on what you've been up to?
Well, I'll give an update on the blood bank if you'd like.
Go for it.
You had all probably seen a bunch of news earlier in March that we had a big shortage of blood, and that was the case for a short time. We've had amazing response from our community, and we're no longer critically low on blood. I just want to thank our community for how many of you came out and donated. I've seen more first-time donors in the past month than ever before, and we're going to need people to continue to donate over the coming weeks and months. So we're still asking for blood donors to come in, but we're doing pretty good over here, and have all the safety precautions in place. We have we're checking temperatures at the door, and we're social distancing within the blood bank, and it's a safe place to come, and it's a great way to get out of the house. You're feeling cooped up.
Thank you, Kate. That's really good to hear. I'm glad things are not critically low anymore. All right, let's see. Rick Wilson, you have any updates? He's busy. Okay. All right. Well, unless anyone else has anything they want to share, we can end for today, just a couple minutes before 1. All right. I want to say a big thank you to Ken and Al, Amanda, all of our guests for joining us. Great to see you virtually. And I'll see everyone next week.